The LGBTQ plus community faces unique challenges during the COVID-19 crisis. There are estimated to be nearly 14 million LGBTQ plus adults and 2 million LGBTQ plus youth in the United States. Many of them have faced economic implications and lack of access to resources.
Almost a quarter of LGBTQ people live in poverty. 1 in 10 is unemployed. And Black and Latinx transgender women are more likely to live in poverty than transgender people of any other race.
With the COVID-19 pandemic, many businesses have been significantly impacted in attempts to stop the spread of the virus. Businesses have been forced to close, reduce operation hours, and lay off employees. Businesses in the restaurant, food industry, healthcare, K-12 education, colleges and universities, and retail are the top industries affected. LGBTQ people hold 40% of the positions in these industries, which makes their current risk of or underemployment high.
Did you know that 17% of LGBT people have no health insurance compared to 12% of non-LGBTQ people, and 1 of 5 LGBT people have not gotten medical care when needed because of the inability to afford care? Did you also know that nearly 1 of 4 LGBTQ adults of color, over 1 of 5 transgender adults, and nearly 1 of 3 transgender adults of color have no health coverage?
About 40% of homeless youth are LGBTQ. They rely on schools and colleges for things like food, social support, medical care, and housing, more so than non-LGBTQ youth. Since COVID, they may also be stuck in homes with people who are unsupportive or even rejecting, experiencing increased social isolation.
Older LGBTQ adults experience higher rates of social isolation because of family rejection, discrimination, and a lack of programs targeted specifically to their needs. They are twice as likely to live alone and 4 times less likely to have children, which may lead to a lack of familial support and increased social isolation. With COVID, older LGBTQ folks are likely to experience even more barriers in accessing needed supports and services.
What are the implications for social workers? What is our responsibility? As the COVID-19 challenges increase, social workers should be able to assess, intervene, and treat the unique needs of the LGBTQ population. Agencies across our communities have programs and resources that can help reduce and eliminate the unique needs of the LGBTQ population. Social workers should advocate for this population by implementing new programs. Additionally, social workers should challenge any policies and procedures that exclude the LGBTQ population. Did you know that in many states, including Kentucky, it is still legal to discriminate against the LGBTQ population? Social workers across all systems should challenge legislators to enact laws that promote inclusiveness and protection of the LGBTQ population. For more information, you can visit the Fairness Campaign.